show you what the nurse in a school or kindergarten should know when supporting a child with spina bifida and hydrocephalus. I'm Slavia Kostadinova from Spina Bifida and Hydrocephalus Bulgaria Association, and next to me is Simoneta Popova, a healthcare professional.
Hello! I'm sure that this educational video will be useful and interesting for all healthcare professionals in kindergartens and schools.
We'll summarize the most essential when providing healthcare services at schools and kindergartens. However, we invite you to check out the Multi-in manual for nurses and healthcare professionals. There you will find more details on the topics covered here. The manual is free on the Multi-in Project website.
Okay, let's get started.
In spina bifida, in the process of embryonic development, the distal end of the tube does not close, resulting in failure of the spinal cord and spinal column to form properly. There are three most common types, and the symptoms may vary depending on the type and the level of involvement. Myomeningocele (MMC) is the most severe form, an open neural tube defect. Most often when people talk about spina bifida, they're referring to MMC. Fetal surgery is an option, but most infants with MMC have closure surgery shortly after birth. However, this surgery cannot repair the nerves that are already malformed. There is a loss of motor and sensory function below the defect. Hydrocephalus are not Chiari mobility limitations, loss of sensation in legs. You can see listed some of the common secondary medical conditions associated with spina bifida. Through prevention and management of secondary conditions, potential health risks can be avoided, so persons with spina bifida and hydrocephalus can enjoy a full and decent life.
Around 90% of infants with MMC develop hydrocephalus in the womb or shortly after birth. MMC is one of the most common causes of hydrocephalus. Hydrocephalus is the accumulation of cerebrospinal fluid in the ventricles of the brain, which can lead to increased intracranial pressure and compression of the brain. The most common treatment is the surgical insertion of a drainage system called a shunt. The shunt system diverts the excess accumulation of fluid from the brain to another part of the body. The peritoneum is the preferred area, but there are also other options. Many children require multiple shunt revisions during their lifetime. It is shunt monitoring that is one of the most important moments in nursing care in school and kindergarten.
We go into medical details because the video is aimed at the healthcare professionals and targets to support them in their specific area of impact. However, our first advice is see the child. Before all diagnoses and complications, see the child with his or her dreams and fears, talents and strengths. This will make your support the most complete.
The main goals of the healthcare provided to the children with spina bifida are to manage the secondary conditions and to promote their independence. The conditions we'll be talking about are more common in children with MMC. Students with milder forms of spina bifida also need specific care, but probably not to the full extent shown here. We will focus now on clean intermittent catheterization, CIC, shunt monitoring and ambulation assistance. School nursing can be very helpful in many other aspects, such as skincare, maintaining a healthy weight, and dealing with latex allergy symptoms. You can read more about them in the Multi-in manual for nurses and healthcare professionals.
Many children with MMC have problems with urinary functioning, including urine retention and stress incontinence. Neuropathic bladder can develop urinary system distress with urinary tract infections that can cause kidney damage.
CIC is a method of draining urine via a disposable catheter inserted into the urethra at regular intervals during the day. Once the urine is drained, the catheter is removed. It is a clean technique, but it's a gold standard for bladder management in patients with spina bifida. For many people, this is the way to maintain good kidney health and manage incontinence.
The nurse is the team member who is qualified and can be responsible for the CIC in the school and kindergarten. This activity is so important that sometimes it is the only factor determining the successful inclusion. Despite the widespread use of CAC around the world for 4 decades now, in some countries it is still not well known, although it's not difficult at all. Many children and parents perform CIC, and this should not be a problem for professionals. In the appendices of the Multi-in Manual for Nurses, you will find some basic tips for the successful application of this method at school and the main steps in CIC for girls and boys described in detail. The steps contain illustrations provided by B. Brown Medical.
Most people with spina bifida have some degree of bowel dysfunction, which occurs as a chronic constipation and bowel incontinence. An individualized bowel management program can help most children with MMC to achieve some degree of bowel continence. Usually, the bowel washout procedure is carried out as part of the evening regimen, and the nurse is not involved in this.
However, cases of incontinence at school are possible. The child must know that help with cleaning and changing clothes is always available in the health office, and that will be provided discreetly. It is good for students to have a second set of underwear available for such cases. Talk to the parents beforehand and discuss with them possible actions in this situation.
Although students with spina bifida may have partial or complete paralysis, they may still be able to move and to walk with a variety of assistive devices: orthoses, crutches, wheelchairs. Nursing care in ambulation may include placing and removing child's orthoses, which is especially important for children in kindergarten. When removing the orthoses, pay attention to sores or redness that do not fade within 30 minutes after removing them. The nurse can help with positioning the student in the wheelchair according to the recommendations of the therapist and monitoring his or her position during the school day in order to prevent spinal deformities. The nurse can assist in transferring the child and can also teach the students how to do it safely on their own and to improve their independence. In children with hydrocephalus, there is always a risk of complications with shunt malfunctioning. It can occur due to mechanical failure, infections, blockages, or drainage problems. The symptoms of shunt problems may vary. Some symptoms develop more slowly and are chronic. In these cases, the nurse should alert the parents and the child's family doctor. Other symptoms require immediate consultation with a neurosurgeon or neurologist. It is essential that adults are well aware of the symptoms of shunt malfunctioning and know when to consult the child's doctor. It is also very important that children be able to recognize such symptoms. The school nurse can monitor for such signs, but also train the teachers and the child. All children can find themselves in a situation where they require emergency medical help. The risk is higher in children with spina bifida and hydrocephalus due to their specific health conditions.
Of course, this doesn't happen every day, but it is recommended that the nurse knows the common risks and how to act according to the needs and the condition of the child. In Appendix 7, you will find information on the most common emergencies in children with spina bifida and hydrocephalus, and the main steps that the nurse should take before the arrival of the emergency team. Achieving a full understanding of the health needs of children with spina bifida and hydrocephalus is difficult because these are complex conditions.
Therefore, it is recommended that the nurse keeps special health passport. The health passport contains systematized basic medical information and allows the nurse to quickly and easily review the most important aspects of the child's condition. A sample form of such health passport is attached to the manual for nurses. Our advice is to fill it in together with the parents and the child in the beginning of the school year. Do not forget to ask for copies of the main healthcare records and fill in the contacts of the doctors.
Joint work with parents and the pedagogical staff at school is extremely important.
The role of the nurse in the multidisciplinary team is not limited only to directly providing specific nursing procedures. The help of the nurse is also needed to support the efforts of other team members aimed at successful inclusion. The nurse has the important responsibility to inform other members about certain aspects of the child's health in the context of the child's need for specific support. The nurse can inform the class teacher that the child should go to the toilet at any time and also give guidance to the PE teachers on the appropriate exercises and sports. It seems more than clear how strong the impact of the nurse is in the inclusion process, even though the nurse is not a teacher. We hope that along with useful tips, we have brought you motivation and inspiration.
And finally, we again invite you to check out the Multidisciplinary manual for nurses and healthcare professionals. You can download it from the Multidisciplinary platform.
Good luck!